All right, I'm gonna be honest with you about something today. As a urologist, I've heard a lot of different myths. And I've heard pretty much every single myth out there. Whether it's an old wives' tale, whether it's a Reddit theory, I've heard it all. And honestly, a lot of them can be right, but a lot of them also can be very wrong. The kind of wrong that actually can be hurting people, leading them to chase wrong treatments, ignore the real problems, or worse, sitting at home suffering because they think nothing can be done for them. So today, I'm gonna bust 5 health myths that I hear non-stop from patients. And I'm not gonna go over like the obvious ones. I'm not gonna sit here and tell you, hey man, drink more water. You already know that. I'm not gonna sit here and tell you, you need to eat less calories to lose weight. You already know that. These are the little sneaky ones, the ones that I end up clearing up in my office almost every single week. And let me tell you, the number of people who still believe number 4 is just crazy. So let's get into it. Myth number 1, erectile dysfunction is just a bedroom problem. When guys come in to see me with erectile dysfunction, their first concern is almost always that there's something wrong with them internally. And the conversation usually leads to, hey, maybe this is gonna affect my relationship. Is she gonna leave me? Am I gonna be dependent on this pill? And I'm less of a man because I need this pill. But what most people don't realize is that ED can show up 3 to 5 years before a heart attack. The American Heart Association, as well as the American Urologic Association, actually both recognize this. Erectile dysfunction is often an early warning sign of cardiovascular disease. In fact, men with ED have about double the risk of heart attacks, strokes, cardiovascular death. And the reason is that most heart problems don't actually start in the heart. They actually start in your blood vessels. Stiffening, narrowing, plaque buildup, all of that happens gradually throughout your body. And guess what? The blood vessels that fill your penis are some of the smallest in the body. So they actually show damage first, before your heart shows symptoms, before the chest pain, before the shortness of breath. That's why I tell all my patients, if you're in your 40s, if you're young, if you're having new or worsening erectile dysfunction, please don't just order pills online and like say, all right, that's it, I'm gonna call it a day, like, hey, my problem's solved. Yes, those medications work. Yes, some of these online places are legit, but they could just be treating the symptom and not actually the true cause. For all my females watching right now, if your partner is dealing with this, it's not personal and it's not about you. It might actually be your body or his body waving a red flag about his actual heart. So encourage him to go see his doctor. Get his blood pressure checked, get his cholesterol checked, get his blood sugar checked. This really isn't just about a better sex life. It's literally about saving his life. Myth number 2, if you're feeling tired, brain fogged, or your sex drive is low, you just need testosterone. This one is huge right now. You can't scroll through social media. You can't go on Google or chat groups without seeing guys in tank tops or telling us about their strong credentials, wellness, and men's health. These guys are there trying to sell you testosterone like it's some kind of miracle drug out there. And listen, low T is a real problem. Replacement therapy, like when we actually replace testosterone, legitimately actually helps a lot of men. But here's what the actual data shows. And these numbers aren't something I'm making up. They actually come from the American Urologic Association. The number of men getting testosterone prescriptions has nearly tripled in the recent years. Up to 25% of guys starting testosterone never even got their labs checked. Nearly half never get their levels rechecked after starting testosterone. And up to 1/3 of guys on testosterone don't even meet the clinical criteria for being deficient in the first place. Now, to me, this is pretty wild. Here's what's actually happening for a lot of these guys. The symptoms of low T, fatigue, low libido, mood changes, brain fog, those are also the same symptoms of poor sleep, chronic stress, sleep apnea, thyroid problems, vitamin D deficiency, vitamin 12 deficiency, diabetes, and even just being overweight. So let me tell you something. I've actually experienced these symptoms myself, and I thought I had low testosterone. So what did I do? I went and got my labs checked. Then I got this alert, your testosterone's back. I was expecting it to be low. I was like, all right, I'm gonna get on testosterone therapy. And guess what? My number was normal. My testosterone was about 460. The lower threshold is about 300. We like for it to be between a range of 300 and 800 according to the guidelines. So my levels were actually totally normal. So when I took a deep dive in like, what else could be going on? It turns out my real problem was actually my sleep. My sleep was terrible. So I focused on my sleep. How can I sleep better? And guess what? A majority of my symptoms actually went away. So before you jump on this bandwagon, testosterone for life, like, hey man, this is gonna help in so many different ways, before you get sucked into this Reddit threads or like these influencers pitching this stuff, or, direct to consumer marketing from online companies, get a real workup. Check your sleep, check your thyroid levels, get your vitamin levels checked, check for sleep apnea, look for stress, look at your weight, look at even your relationship and your communication. A lot of guys, if they truly focus on personal changes they can make, lifestyle changes they can make, relationship changes they can make, sometimes that fixes the problem without ever needing testosterone replacement therapy. Number 3, cycling causes erectile dysfunction and prostate problems. This one is everywhere. And I'll be honest with you, I actually believed it myself. During the COVID pandemic, I actually bought myself a stationary bike. I mean, we were home a lot, you couldn't really go to the gym, and everyone online was saying, hey man, this Peloton bike is the best thing ever, join a ride. So I really got into it, and I actually got myself one. And I actually really got into the rides as well. I'm like, man, this feels good. I'm exercising, losing weight. I have this whole team mentality going on when I'm doing my rides. But a few weeks in, I started feeling this weird pressure in my pelvic, perineal area. And as a urologist, my mind immediately started thinking about the worst, because guess what? So many times a week in my office, I'm seeing guys with chronic pelvic pain in their prostates, their pelvic area, everywhere else down there. I'm like, oh my God, do I have this problem now? And all I could think about, the only different thing I started to do was actually start riding this stationary bike. So did I mess up my prostate? Am I gonna have chronic pain now? Am I gonna have issues with erections now? Oh my God, my testosterone's gonna be low. Oh my God, my life is over. This is gonna be permanent. I'm not exaggerating. My mind really went down this spiral. But then I took a step back and I realized, you know what? I'm probably freaking out. So I stopped using the bike for a few weeks and things got better. So I did truly have a problem, but I also knew what the cause of the problem was, and I got better. I don't have any chronic issues right now when it comes to down there. So I stopped using the bike, started collecting dust, and I decided to sell the bike. But when you look back at this story, I was completely wrong. The science on it is actually pretty clear. Regular cycling does not increase your risk of erectile dysfunction or chronic pain. In fact, multiple studies show that cyclists often have better sexual function than guys who don't exercise at all. So where exactly does this discomfort that I was feeling in my prostate, that some other people may be feeling? Honestly, it's probably not your prostate. It's probably the pressure on your perineum, that soft area between your scrotum and your anus. There's nerves, there's muscles, there's blood vessels running through that entire space. A narrow bike seat or bad posture can really irritate those tissues. And it turns out, when I look back, when I had the cycle in my house, the seat wasn't really the problem, it was really my posture. I never really took the time to watch the training videos, the tutorials, to adjust my bike for my posture, for my height, where the handles are supposed to be. I was like, you know what? I'm a doctor. This is really exciting. How hard can this be? I just got on it. So this irritation that happens, whether it's because of pressure, irritation, inflammation, it's not gonna cause permanent damage. And the reality is, it has probably nothing to do with the tool or anything like that. It's probably, when it comes to cycling, it's probably the bike seat or something related to your posture. So if you're feeling discomfort when cycling, quitting is probably not the best fix. The fix is adjusting your seat height and your tilt. It's also perhaps stopping and pausing every 10 to 15 minutes if you're doing a long ride. It's about wearing padded shorts. And perhaps you don't try to do a 1 hour ride the first day or week you end up getting this bike. Perhaps take it slow. Start with 5 minutes, then 7 minutes, then 10 minutes. Gradually work your tolerance up on that bike so you can avoid pain, discomfort, and things that I was feeling when I was riding my stationary bike. I made the mistake of selling my bike for pretty much nothing. So in this specific case, don't be like me. You know what? Keep riding. Stay on your health journey. You just need to be smart about things when you actually start doing new things. Number 4, breast cancer only happens in women. I know what you're thinking. Come on, Dr. B, I don't have breasts. How am I gonna get breast cancer? I'm a dude. But the truth is, men do have breast tissue. Less of it, but it's actually there. And about 1% of all breast cancers actually occur in men. That's roughly 1 in 726 men in their lifetime. It sounds rare, right? But because guys don't really think about it happening to them, breast cancer in men actually often gets diagnosed way later than it should. Stage 3, stage 4, when treatment or cure can actually be much, much harder. I actually remember I had a patient. I saw him a few years ago. He came to the office and he started telling me that he's been having some enlargement in his breast area. You know, I initially thought, oh, it's probably a side effect of one of his prostate medications. Turns out he wasn't even on this prostate medication. So then I did a quick exam and I could tell that one side, the right side, just didn't feel right. There was definitely something off. And plus he was telling me that he noticed a change. So I phoned up his primary care doctor. We got on the same page and I actually ended up that day ordering a mammogram for him. The mammogram actually came back abnormal. Long story short, he got a biopsy. He was diagnosed with breast cancer. He got treated. He got treated early. And he's pretty much cured now. But this would have never happened if I had discounted his symptoms. It would have never happened if he hadn't brought it up. It would have never happened if we didn't get a mammogram, he didn't get checked out, and he got treated. So here's what you need to know. Genetics really matter. If you carry a BRCA1 or BRCA2 mutation, the same genes everyone associates with female breast and ovarian cancer, your risk goes way up. Men with BRCA2 gene mutations have a 7 to 8% lifetime risk of breast cancer. That's not small numbers, guys. And those same mutations also raise your risk of prostate cancer. So if there's a strong history of breast or ovarian cancer in your family, your mom, your sister, your aunt, that's not just a women's family history thing. The men in the family also need to know about it. And here's what to do to look into this yourself. If you have a lump in your chest area, nipple discharge, changes in the skin, swelling, even if your man boobs feel weird from one side to the other, don't ignore it. Don't laugh it off. Get yourself checked. When it comes to this cancer, it doesn't care about gender. Myth number 5. A vasectomy is going to kill your testosterone, ruin your sex life, and turn you into a different man. I actually hear this one quite a few times a month in my office. Guys sitting there right across from me. Sometimes their +1 is over there and they're like severely terrified. They're here for a vasectomy consult, but they're convinced that the moment I cut into that tube, that little tube called the vas deferens, and perform a vasectomy on them, their entire life is going to change. And honestly, it's not true. It's not even a little true. A vasectomy does not lower your testosterone. It does not lower your sex drive. It does not change your erections. It does not change the volume or sensation of your ejaculate in any meaningful way. The only thing it changes is that there's no longer going to be sperm in your semen. You're going to be shooting blanks, like literally shooting blanks. So let's look at the anatomy. Your testicles do two things. They make testosterone, which goes directly into your bloodstream. And then they also make sperm, your swimmers. A vasectomy only blocks those swimmers. The testosterone pathway is completely untouched. Your testicle pretty much keeps doing what it's supposed to be doing when it comes to your hormone production. It actually still keeps making sperm as well, but those sperm, after vasectomy, are kind of blocked off. So there's nothing traveling beyond where we've done the vasectomy. So your hormones stay the same, your production of sperm stays the same, but the sperm actually making it into your semen, gone. And here's the part most guys don't expect. A lot of couples actually tell me that their sex lives are actually better after a vasectomy because that anxiety of getting pregnant again, having to change diapers again, having to move strollers around, it's completely gone. The procedure itself takes anywhere between 10 to 15 minutes, and it can be done in the office under local anesthesia, or it can even be done in a surgery center with you getting some gentle IV sedation. A small little opening is made, often so small you don't even see it. We don't even put stitches in these small openings. And after the procedure is done, you go home. You ice it with a bag of peas or ice packs. You take it easy for a few days, and most guys are usually back to their normal routine within a few days. But before we move on, I do have to kind of alert you of something. There's a little disclaimer. After we do the vasectomy, you're technically still shooting out sperm for a while. You're not sterile completely or immediately. It takes a few weeks and about 20 to 30 ejaculates to clear out that remaining sperm. So until you do that, you gotta keep using protection. Once you empty your pipes enough, you're gonna drop off something called a semen analysis. And that can be done in a lab, it can be done in the urologist's office, or the cool thing is the actual semen analysis can be done with home tests in the comfort of your own home. So vasectomy honestly is a fairly safe procedure. It's a fairly effective procedure. It can be a game changer when it comes to your relationship and time in your bedroom. So some of these things that you may hear about or be scared of, it's not really a big deal. But I know I've been very positive about vasectomies. There is something that you do need to know, and that is that 1% of men that do get vasectomies can have symptoms of either chronic pain or chronic congestion in the area of the vasectomy. Now, it's extremely unfortunate. In my career that spans about close to 2 decades now, I have maybe anywhere from 2 to 3 patients that this has happened in, and most of them do get better on their own. And if they don't, there are interventions that can be done. So out of the 1,000 or plus vasectomies I've done, the number of people that have these chronic long-term issues is actually very, very small. So you shouldn't really worry about it. The last thing I want to say is a vasectomy can fail. About 1 in 2,000, that's the number quoted in all the statistics, all the research. The tubes can come back together. I've never had that happen to me as of the date of this recording in any of my patients. But when you do go for your vasectomy consult and they go over the risks and benefits, they are going to mention that to you. But again, don't be scared. Don't be alarmed. Think about that global picture. You want to have stress-free sex in the bedroom, and you don't want to get pregnant again, and you don't want to have to change diapers again. So those were the 5 health myths I wanted to clear up today. There's so many more to cover. So if you want me to cover more, go ahead and leave in the comments what you'd like me to cover, and maybe we'll do a part 2 down the road. The best advice here is don't assume. Don't self-diagnose yourself through Google, ChatGPT, Claude, social media, or Reddit threads. Remember that your body is connected, and what shows up in one place is often a clue about something happening somewhere else. The patients who do the best in my office are always the same ones. The ones who pay attention, the ones who come in early, the ones who ask questions instead of just trying to guess. So if you got something out of this video, please hit that subscribe button. Hit the bell so you don't miss the next one, and drop a comment below. Which one of these myths did you think was true? I read all the comments. I love hearing from you guys. And if there's a topic you want me to cover, something you've been wondering about or been too afraid to ask, let me know down below. As always, this is Dr. B. Thank you so much for watching, and I'll see you in the next video.